Okay. Well, hello everyone. I'm glad you're here today, and we're going to talk about a nutrient that's really pretty key to health, and I think you'll be interested in it. Now, you'll see up here daily manufacturing on the left, daily. And I'm Jim Daly of Daily Manufacturing, and we make vitamin mineral supplements, so including vitamin B12. Also, you'll see on the right a little thing, KISS Science. That's a thing that I have. I like to say, keep it simple, science. Um, I think that's really a nice slogan because I try to make this where people can get something out of it, even if they're not scientists. And hopefully, if you are a scientist, you can get something out of it too. But um, I want to make this so that it really does benefit people listening to it. And we're going to talk about really scientifically grounded overview of B12. Talk about deficiency conditions, requirements and sources and treatments for deficiency, and be a pretty good overview, I think, of the topic of vitamin B12 and how it can benefit you. Now, vitamin B12 is a really huge molecule. It's also just called cobalamin a lot of times. It's a water-soluble vitamin, but kind of unusual in that category. Something that's really unique about it is it contains cobalt. Vitamin B12 is the only thing in the body that uses cobalt. It's usually considered more of a toxic mineral in a way, but you don't really get that much of it, just tiny amounts. But it's essential for DNA synthesis and nervous system function. And it has two active forms, methylcobalamin and adenosylcobalamin. So this is really crucial information because a lot of people don't realize that there's more than one kind of B12 and they function differently and work in different parts of the cell. Now, what are some of the health conditions associated with B12 deficiency? Well, megablastic anemia. That's one you have heard of a lot if you follow B12 a lot. Um, and that's almost always caused by, or very frequently caused by a B12 deficiency. Uh, how about peripheral neuropathy? That could be lupus, uh, MS, diabetes, or a lot of things, or it could just be B12 deficiency. Some of these things when you have a B12 deficiency can seem like sort of pretty serious diseases. The cognitive decline and dementia it could be Alzheimer's disease or it could be a B12 deficiency. Depression can be a mental illness or B12 deficiency. You can also have elevated homocysteine levels. You frequently do with B12 deficiency. That's a very serious cardiovascular disease risk, very likely B12 deficiency. So, these things are serious, but they're also usually pretty easily rectified if you have these deficiencies. But many people have these symptoms. Maybe they're afraid to go to their doctor and afraid it will be something terrible, and they don't, they're afraid to get the diagnosis, that kind of thing, when really they should have gone and been tested for B12 because it was just as simple as rectifying a deficiency. So, it really is something that you should get screened for occasionally. I suggest if you go to a doctor at least once a year, ask them when they do blood work to do a B12 test. I think that's vitamin D and vitamin B12 are two nutrients that I think you should get screened for on a regular basis. But it doesn't always happen that way. Now, what are some of the symptoms that you might have? Well, you can have numbness and tingling. You can have memory problems, difficulty walking, mood changes. You can see up here, over here, you can have vision issues, mouth sores. fatigue and weakness, all kinds of things. These can all be due to vitamin B12 deficiency. Um, Digestive problems can be due to vitamin B12 deficiency. Also, digestive problems can cause vitamin B12 deficiency. It can work both ways, and it often does. So, lots of things can go wrong when you don't get enough vitamin B12. It's something you need very tiny amounts of, but if you don't have it, it's really can cause a lot of problems. Now, let's talk about the daily requirements for B12. It's really not that huge. Adults, 2.4 micrograms per day. Now, a microgram is a tiny little bit, really. And you can get that from just eating 4 eggs. Um, you can eat it from 3 ounces of tuna. Uh, Big Macs don't have quite as much from volume, but 3 Big Macs would give you that 2.4 micrograms a day. Of course, if you're pregnant, lactating, that kind of thing, you need a little more because you have a greater demand for it. Not a whole lot more, but a little bit more. And of course, uh, higher needs in older adults a lot of times because they don't absorb it as well. And in fact, poor absorption is the greatest cause of vitamin B12 deficiency. It's not really as much um, people not getting it in their diet, usually. There are people, vegetarians, for instance, don't get that much in their diet. Vegans get pretty much none in their diet. And so they're at a greater risk and they should almost always take a B12 supplement. There's not many ways you can get it otherwise. However, it doesn't take a whole lot for a person to get enough if they, eat meat in a standard diet, as long as everything is working right. And that's where the catch is. A lot of times everything doesn't work right. Now, there's two, like we mentioned before, two active forms of vitamin B12. Two functional ones. It's methylcobalamin is one that you need the most of in the body. It's a form that it acts in the cytoplasm of a cell, and you can look at the cell here. And the cytoplasm is all this stuff surrounding these organelles in it. So it's just in the main part of the cell. And that's pretty much every cell, almost all cells in the body. Adenosylcobalamin works in the mitochondria, the energy factory of the cell. So they have two different places that they work in the body, and they have very different functions. And both are really critical to uh, having a normal, healthy life. Methylcobalamin, as we mentioned before, works in the cytoplasm of the cell. It's a cofactor for methionine synthase. And if you can remember when we talked about folic acid, it's part of that cycle where folic acid uh, works, and they work hand in hand. They convert homocysteine to methionine. And that's why if you don't have enough B12, you have elevated homocysteine levels. Homocysteine has to be converted to methionine to be utilized for many of the reactions in the body. Supports methylation reactions, and it makes something in the body called S-adenosyl methionine. Some people just call it SAM, some people call it SAMe. But I remember my professor at university in biochemistry says, okay, you're going to get to know Sam very well this semester. And it's a acetylmethionine is an active and universal um, contributor of methyl groups for the biosynthesis of almost everything in the body. So it's a really key um, part of metabolism that is absolutely dependent on vitamin B12. And here's a kind of a little illustration of the folate cycle, and it's a different one that you saw previously when we did the talk on folic acid. That's a difficult topic. It's a hard one for most people to grasp, so we won't get too deeply into this. But you can see right here, this is what it's all about. The folate and the B12 is making this right here, the SAM. And that's an N-acetylmethionine. From there, it just goes on to manufacturing lots of things. It's a it's incredible how busy these little cells are. They're just like factories with all kinds of things running around and doing this and doing that inside those little cells. You know, like the Bible says, we are fearfully and wonderfully made. It's really quite a mind-boggling uh, concept, just what all does happen inside of these cells. And they are all dependent on this cycle here with folate and B12. We're talking about DNA synthesis, red blood cell formation, myelin synthesis, homocysteine metabolism, all these things that are very critical to our everyday life. Adenosylcobalamin works a little differently, and it works in the mitochondria of the cell. It's a cofactor for methylmalonyl-CoA mutase. Oops, you don't have to remember that. Anyway, it's a big word, but it converts methylmalonyl-CoA to succinyl-CoA. Now, succinyl-CoA is one of the factors you may remember the Krebs cycle, where the body takes basically the breakdown products of sugars and extracts um, energy from it and then sends it on off to further processing in the electron transport chain. But anyway, succinyl-CoA is in that pathway, that Krebs cycle, we refer to it, or citric acid cycle. And it's absolutely great for making energy out of your proteins, carbohydrates, and fats. So very important for uh, energy metabolism. And, that energy suffers when you don't have enough of the adenosylcobalamin. It also, when that methylmalonyl-CoA there that we're talking about isn't converted, it becomes toxic and it can damage nerve cells in particular. So that's something that one of the reasons why you have symptoms that sometimes resemble multiple sclerosis when you have deficiency in adenosylcobalamin. So we have functions just shown here for the adenosylcobalamin, the methylmalonyl, oops, CoA mutase we're talking about, and really everything in here is related to that. The neurotransmitter synthesis, a myelin sheath that degrades if you don't have enough of it, um, the propionate metabolism, that's an odd chain fatty acid that doesn't get metabolized. And these things all kind of mess up the works when you don't have enough adenosylcobalamin. And that's why you have some of these neurological symptoms when that part of it gets um, too low. And so we know that looking for this in the blood, the methylmalonyl-CoA or methylmalonic acid, is one way of determining if you have a B12 deficiency. Now, let's talk about the absorption of B12 for a minute. It's really a complex process. It's not easily absorbed in the body because it is such a huge molecule. It's arguably the largest non-polymer molecule in the body. It's one of the largest for sure. In fact, not just in the body, but in nature. There's very few that are that huge. If you remember that um, picture we showed at the first, that thing's a massive molecule. So when you eat food with vitamin B12, First of all, the absorption of B12 begins in the stomach. Well, really in the mouth, because that's where you start sending out signals. And you chew your food and help it start releasing B12 uh, to be utilized in the body. Then it goes down to the stomach, where the stomach acid um, here binds, well, no, in the stomach, you have the parietal cells that do two things. Parietal cells release hydrochloric acid, which is absolutely essential for getting that B12 in a free form, and pepsin, which also is essential for that. And the other thing it does, besides the digestive part, is to release a protein called intrinsic factor. Now, the intrinsic factor is something that'll go with it into the small intestine, where the intrinsic factor protein binds to vitamin B12. That's a very essential part of the absorption of vitamin B12. And really, it's kind of unique to all nutrients. There's not many, I don't know, I don't think there's any other nutrients that actually have a factor that has to bind to them like that in order to be absorbed. Um, but in the small intestine, that will bind there. Also, a transcobalamin 1 protein will bind to it too. That'll all carry it through the small intestine. Now, if you remember the small intestine, it starts out with the duodenum, and that's where this kind of takes place, this first part, the binding to the intrinsic factor complex. Then it goes on through the rest of that. It goes into the jejunum, which is the second part of it, of the small intestine, and then to the ileum. Okay, the ileum down here is where this complex with vitamin B12 and transcobalamin 1 and um, the intrinsic factor, you know, is absorbed into it's split apart really, and then the B12 is absorbed into the ileum. Now that's right at the very end of the small intestine, just before it opens through the ileocecal valve and goes into the large intestine. You know, it's kind of ironic. B12 is made, it's not made by animals. You get it from animals. The animals don't make it. It's made by bacteria. And there's actually a lot of B12 made in your colon if you have the right bacteria. And most people do, I think. So there's a lot of B12 made there, but you can't absorb it down there in the colon at all because it's so large and very few things can be absorbed in the colon, and what the things that can are usually very small molecules, which B12 is not. So the B12 is there right at the end of the small intestine. It's absorbed, and then it's transported to the bloodstream where it binds to transcobalamin 2. Cobalamin 2 sort of carries it through the blood system, circulatory system, and delivers it to cells where if everything works right, and you know, a lot of times it doesn't, but a lot when everything works right, it's the B12s goes into the cells. It's broken down. If it's a methylcobalamin, it loses a methyl group. If it's a hydroxycobalamin, it loses that hydroxy group. If it's cyanocobalamin, it loses a cyanide group there. You know, so it's broken down into just uh, basically free cobalamin. And then, depending on where it's needed, it's bound to either a methyl group to make methylcobalamin or to adenosine to make adenosylcobalamin. And then it goes to where it needs to be in the cells. Now that gets to a question about supplements because, you know, a lot of people will say that you're wasting your money if you're taking regular B12 like hydroxycobalamin and cyanocobalamin. That really isn't quite true. Um, for if everything's working right, those work pretty well because it's going to be broken down and put back in. Most of it will. Now, there's always some of the other forms that do uh, get transported through intact. Some does, but most of it's going to go through this process of being broken down and then reformed into the active forms. So for most people, the uh, less expensive forms, and they're not much less expensive, actually. That's one thing about it. B12 is expensive no matter which form you get. But the ones that are more common are not ineffective for the majority of people. However, the adenylyl and methylcobalamines that are um, the active forms, if you some of these things aren't working right, can be have extra benefit. And there's a number of places where things go wrong. This transcobalamin, for instance, doesn't always release right and doesn't work right. All of these intestinal, each step has places where the system breaks down. There's quite a few people that don't make intrinsic factor well. The If you're on, you have a lot of people that don't release the things they need here in the stomach to digest B12 and have it absorbed. This conversion in the cells doesn't always work right. Sometimes people don't do that well. And if they don't get some of the methylcobalamin and deoxyadenosylcobalamin, they're going to have problems. So all of these things break down in certain situations. And that's why we do use methylcobalamin and adenosylcobalamin in our supplement. It's cost a little bit more, but it gives you a little bit extra protection. Um, Actually, it's worthwhile to do. And so, you know, but the people you'll see on Facebook and different places say, "Oh, you're just wasting your money," if you're using, regular B12. Well, they're not being honest, honestly. It really isn't true. It's not quite that bad. It is good to take the active forms, in my opinion, and it gives you a little bit better assurance that you're going to get the full benefit. Now, most vitamin B12 deficiency is due to poor absorption, not inadequate intake. A lot of people feel like, well, if I eat meat and I, you know, eat a normal diet, healthy diet, I should be fine with B12. And I guess in a way you should be, but most people who are deficient in B12 are eating meat and things. B12 is really hard to absorb. And so that's where most of the deficiency comes from. Uh, a friend of mine that I play pickleball with was recently diagnosed with vitamin B12 deficiency. She eats meat. She's not a vegetarian, but she became severely deficient in B12 and she got vitamin B shots, vitamin B12 shots. Now, it's amazing if you're severely deficient in vitamin B12. She says almost immediately, it's like she came out of a fog. Her brain cleared up. She could think better, had more energy. I mean, it's really a rapid process when that happens. So, it's something to take seriously and don't think just because you eat a mixed diet and you're getting B12 in your diet that you are safe, because that's really not the case. And there's lots of different kinds of situations that make you likely to become deficient. Pernicious anemia, which is a lack of intrinsic factor, can be certainly one of them. it's often caused a genetic thing where you just genetically don't make it very well. Uh, that's fairly common actually, and you can certainly um, benefit from B12 if that's the case. Uh, Gastric bypass surgery pretty much shoots, yourself in the foot as far as getting B12. Atrophic gastritis, you'll see that the parietal cells are damaged. You can't metabolize it right. You don't make the intrinsic factor well. Uh, Long-term proton pump inhibitors. People who um, have good stomach acid simply don't absorb B12. Inflammatory bowel diseases. Uh, those people really are almost always short in B12. Intestinal parasites, especially tapeworms, uh, absorb a lot of the B12 and make it unavailable for people. Metformin is something that causes B12 deficiency, uh, causes people not to absorb it, and we're not completely sure why, but it appears to block the binding of B12 to intrinsic factor. That's still kind of something that's a little bit up in the air and being studied, why it does that. But it's a well-documented fact that it does. Uh, People that are all the time just popping antacids all day long, you know, uh, they're really doing a number on their B12 absorption because you've got to have that stomach acid. If you do that, you're not going to absorb B12. And, so that's just not a good way of approaching that problem. But, you know, a lot of that can be helped with uh, B12 supplements. Um, because B12 supplements, when you take them, if you take, say, 500 microgram dose like we have in ours, about 1% of that will be absorbed without the intrinsic factor by a passive diffusion across the gut. So if you think about that, that's 5 micrograms, twice the dietary requirements that you can absorb just passively by just taking a high dose of B12. And 500 micrograms is pretty high. Now, if you're really severely deficient, you're going to want to take more than that because it can take a while to build back up. But for most people, 500 micrograms is a really nice dose uh, to take. But who's at risk? Well, older adults in particular, vegetarians and vegans are definitely at risk and very well documented because they just don't get that much. Uh, Patients with gastrointestinal disorders, any number of disorders, metformin users, which are, that's one of the most common drugs out there. Um, People with genetic disorders involved in this process and potentially almost anyone. Um, so, it is such a common deficiency that you really should get checked for that periodically to make sure that you are okay. The diagnosis is basically serum B12 levels, methylmalonic acid in the blood if it's elevated, homocysteine levels if they're elevated. There's clues with a complete blood count that they do pretty routinely, but it's not really definitive. I really think you need a little bit more than that. Also, someone with adequate B12 levels but elevated MMA, that's kind of a area where you might think about there being particularly deficient in the adenosylcobalamin because it's the one that's involved with that methylmalonic acid we're talking about, converting it to succinic acid. So that might be a clue that you're really deficient just in that one, and you've got something going on where you're not making it acetylcholine well. Now, how do we deal with the deficiencies in vitamin B12? Well, first of all, uh, oral supplementation. That's the main way of dealing with it. If except medically, if you're getting the shots. Sublingual forms are available, or the ones you swallow. Sublingual forms, um, it's not really absorbed sublingually, but you should consider that it just goes into your uh, down your throat and into your stomach where it's absorbed just like all the others. Um, Dietary fortification, intramuscular injections. However, usually we talk about the water soluble vitamins, which B12 is one of them, needing to be taken between meals. That's not really the case with vitamin B12. It's an exception to that. Vitamin B12 should be taken with meals because the eating the food stimulates the production of the gastric acid, stimulates the production of the pepsin, the intrinsic factor. All that begins from signals from the mouth, really, that food is coming, B12 is going to be there, and it needs to be worked on. So you really should take B12 with a meal. uh, the vitamin B12 supplements are essentially pre-digested. So it's not important to have the gastric acid perhaps as much and the pepsin as with the foods. However, you still need that intrinsic factor that's also released by the parietal cells. So, you have the battle partly over. Um, when you take a B12 supplement because it doesn't have to be removed from the food matrix, which is a pretty involved process. Um, so the vitamin B12 supplement, like we have here, and as I mentioned, it can about, even if you didn't have the intrinsic factor at all, you could still absorb about 1% of it. And with 500 micrograms, that's a pretty good amount. It supplies both methyl and acetylcholine. And although if everything's working right, that shouldn't make a big difference that it be in these forms. But we assume that everything isn't going to always work right. So we do supply it in the active forms. And in fact, our B12 is the only one I've seen that has both of those in it. Now, I'm sure there's other people that have done that. That's not new to me. However, the adenosylcobalamin is a particularly hard one to get. It's not many ingredient suppliers out there have it, so it's often difficult to source, and it's a little bit more expensive. It's fortunately one that you don't have to have quite as much of as the methylcobalamin. So I really feel like we've got the ideal vitamin B12 supplement, and that is, you know, a dose that should work well for almost everybody. If you're severely deficient, I would suggest that you get the shots and get it built up more quickly. However, if you're not severely deficient, taking one of these a day would put you in pretty decent shape pretty quickly, uh, because you just need to, start getting the right amount in your diet. With that, I'll open it up to questions. I do have one page here. This will be on the internet on YouTube. And if you wanted to look up the references, these are some of the key references for this information. Now, like I say, I suggest that everyone get their doctor to measure B12. And I always say the same thing about vitamin D. These are things that are easily overlooked, and people don't know they have it often, and yet they're really is having a very detrimental effect on their health and well-being. So I'll open it up. If anyone has questions, I'll be happy to try to answer your questions. And I hope that you learned enough here today to know that, this is something you need to pay attention to. Any questions out there? Observations? If there's anything you didn't understand that I said, and that's frequently the case, yeah, I'd be happy to explore that a little bit more depth. Okay, well, if there's no questions, then I guess we'll sign off for today. I I suggest that if you're a vegetarian or vegan, definitely add B12 to your diet because that's really important. And if you're not, at least still maybe once a year, get checked out for B12 and go a little bit beyond just a CBC uh, because that's not quite adequate. And with that, I hope you all have a wonderful evening, and we'll talk to you next month.
Thank you, Dr. Daly.
Thank you.
Thank you. Bye.
Okay, goodbye.
Bye bye.